like I Googled it, craniofacial pain, and it took me there to that website, ITSMN.com, and I started reading about TMJ. And okay, facial pain, okay, teeth, maybe, okay, let me continue to read on. And it was like someone wrote a book about me, from the migraines to the dizziness for no apparent reason, to the ringing in the ears that just totally drives you nuts, to the jaw clicking and the jaw pain. And I'm like, okay, I'm experiencing all of these things, but there's no way it could be my teeth, my jaw. And like I just continued to read on, and I read a couple of the testimonials from other people who had suffered for many years more than I have. 2.5 years is a long time, but there are many people out there who have suffered a major part of their life because of TMJ and not being diagnosed and not thinking that it's possibly a problem with the jaw. And I clicked on Dr. Feld, and I started reading about his practice and how he specializes in this, and I just decided to give him a call to see if this could help me, if he could help. Basically, the symptoms started out with a spell of vertigo, and I ended up in the ER, and they kind of took x-rays and everything and did a CAT scan and just kind of said, well, maybe it's sinus problems, and kind of sent me on my way. Suggested that I see an ear, nose, and throat doctor. And that started a whole chain of reaction from the ear, nose, and throat doctor to 3 different neurologists. From one of the neurologists telling me basically all I could do was pray to get better, that he couldn't help me. From there, I started to seek alternative therapy. I went to an acupuncturist. I started taking herbs. I started physical therapy, thinking that maybe everything was from stress, and no one could really help me. I received several nerve blocks in the back of my head and the occipital nerves to try to stop the pain, several different migraine medications, antidepressants, because, since they couldn't find anything on, I've had 5 MRIs, 2 on the brain, 1 on the ear canal, 1 on the orbits of the eye, and 1 on my cervical. Nothing was found. I was even told that this is psychosomatic illness, that it's all in my head, it's in your head, because they figure, okay, you're not a doctor, so you can't treat yourself, but these doctors are telling you there's nothing wrong. We don't find anything wrong with you. There's no tumor. Thank God, we're happy about that. There's no cancer. Okay, that's fine. There's no arthritis. I was having daily chronic migraine headaches out of the blue for no apparent reason, and I just really could not understand why. Why do I have to take a pill every day? And the pill wasn't even helping. And then you end up in ER because the migraine will not go away. Then I have to get an IV med to break the migraine. Nothing's wrong, but why am I having migraines? Nothing's wrong, but I'm dizzy every day. I'm running into the dresser. I'm dropping things. I'm up all night. My ears are buzzing and ringing. It's something, and I've been told I had an aneurysm. I've been told that it could possibly be a brain tumor. I've been told several different things that scared the living daylights out of me. And to come to this point and find out that it was my jaw, that upsets me. And to have gone through so many doctors. And I look back on that and I'm like, wow, not one person even checked this or even mention, maybe you should see a specialist. Maybe you need to go to the dentist. Something as simple as that. That was never mentioned. Never mentioned. So I never thought to go to the dentist. They say, we think you, because you have these headaches and visual problems also, and ringing in the ears. It may be an aneurysm. So I actually had a test done where they stick a catheter through your groin and insert it all the way up through your neck to your brain and shoot fluid through to see if there's an aneurysm. And to look back on that, to see that it was my jaw, and I risked my life trying to figure out what this was and to get out of pain and to stop having the headaches. And it was my jaw. And I let them actually stick something in my brain, and I look back on that like, I'm happy I'm alive to know that it is my jaw, but that was very dangerous. And, you know, I think people do resort to whatever it's going to take to get out of pain because the pain is so bad. And the neck problems and the back problems. And, you know, I told my husband, I said, it feels like I've shrunk. I said, my left leg is shorter than my right. I had a migraine one evening, and I called my neurologist. And I said, you know, I'm in a lot of pain. You know, what can I do? You know, the meds aren't working. And he says, well, you know, sweetheart, there's nothing else that I can do for you. At this point, you need divine intervention. Finding out that it is my jaw, I'm very happy that there will be no surgery. And I could have jumped to conclusions and had surgery just to try to get out of pain, which would have been the wrong thing to do. And no medication. I have bags, thousands and thousands of dollars of medication. From migraine meds, antidepressants. You want to live. You do want an answer. You do want to be out of pain. You know you were once normal, and then something happens, and you're basically a vegetable laying in the bed watching your life pass you by. You know, which pain pill can I take today for maybe a half hour of pain-free, you know? So I started reading, and I just read about his background and a couple of testimonials from other patients. And I said, well, you know, let me see what this is all about. Normally, when you find someone who could possibly help you, it's not in your area. It's out of state, many, many miles away. And thank God for me, he's only 5 miles away. It was amazing. It was amazing, and it was overwhelming to say this is what it is. A long journey, thousands of dollars later. But I'm so very happy that I found him, and it was all through the internet.